Well, my friends, this is another case, a new case of a child aged about 2.5 years. A child aged about 2.5 years is suffering from anemia. The cause is not detected, unknown cause. All the investigations reveals there is no history of leukemia or thalassemia or worm troubles or bone marrow disease. So it is definitely an idiopathic cause. When in medical science the cause is not identified, it has been accepted as the idiopathic cause. Hemoglobin came down from normal range to at present 9.8 gram percentage. You know, the hemoglobin is the essential component of the red blood cells, one of the blood cells of human body. The blood is divided into two parts, the cellular parts and the liquid parts. The liquid part is known as plasma, and cellular parts are divided into three parts, RBC, WBC and platelets. Within the RBC or red blood cells, another name of which is leukocytes, the hemoglobin contains. And by means of this hemoglobin, oxygen is carried out in the red cells. So the hemoglobin contains iron, and for any reason iron is not available, there will be a reduction of the amount of hemoglobin in each of the red cells. And as we shall see, the anemia develops. So the lack of iron can be caused in the several ways. Blood loss অনেক কারণে হতে পারে, অনেক কারণে। অ্যানিমিয়া দেয়ার আর ডিফারেন্ট কজেস। যখন ছাত্ররা অ্যানিমিয়া চ্যাপ্টার পড়ে তখন তাদের মাথা খারাপ হয়ে যায়। সো দি মেন কজেস আর ডিউ টু ব্লাড লস। ওয়ান অফ দ্য মেন কজ ইজ ব্লাড লস। ব্লাড লস অনেক কারণে হতে পারে। দেয়ার আর ডিফারেন্ট কজেস ফ্রম দ্য নোজ অর রেসপিরেটরি সিস্টেম, it is known as epistaxis. From any injury, the blood may be lost from the great vessels. From the lungs, the blood may come out during tuberculosis or bronchiectasis, which is known as hemoptysis. The blood comes by vomiting from the stomach, the gastric cancer, hematemesis. From the kidney damage or kidney stone, hematuria, or the worms, ankylostoma duodenale, which bites within the intestine, the blood may come out. In case of females during delivery or before the delivery, which is known as the antepartum hemorrhage or APAs, or after the delivery when abundant blood loss, which is known as PPAs or postpartum hemorrhage, or due to piles, hemorrhoids, the blood may be lost. From the internal piles or external piles, the blood may loss. So, from the carcinoma, from the peptic ulcer, carcinoma of the stomach, hemorrhoids or piles, APAs or PPAs in case of females, hematemesis in case of gastric carcinoma or esophageal varices, hemoptysis due to bronchiectasis or the pulmonary tuberculosis injury, epistaxis bleeding from the nose or the larynx or the trachea of the bronchus. So these are some of the important causes of normally blood loss, and the anemia may develop. The anemia may develop due to lack of vitamin B12, which is known as the intrinsic factor. Vitamin B12 কম হলে anemia হতে পারে, that is known as pernicious anemia. That is known as pernicious anemia. So, normal blood loss is known as iron deficiency anemia. Vitamin B12 loss or lack is known as pernicious anemia. There may be nutritional anemia. This small child may suffer from nutritional anemia due to lack of iron in the diet, or that is our malabsorption syndrome. খাবার দাবার যা খাচ্ছে তার কাজে লাগছে না, or due to lack of milk milk contains extra amount of iron, সেগুলো না পেলে হতে পারে. So there are different causes of anemia. Our today's chapter is not concerning about the anemia of practice of medicine or pathology. The malabsorption syndrome or chronic diarrhea is a cause of anemia in case of child. So thalassemia, when the blood is broken down, there may be anemia. So in short, the carcinoma of the stomach, malabsorption syndrome of the child, vitamin B12 deficiency, iron deficiency, etc. are the commonest cause of anemia. There may be also causes bone marrow defect. Bone marrow যেখানে তৈরি হচ্ছে না, that is also a cause of anemia. However, what will be the approach of our homeopathic treatment for this child? The child develops many symptoms, catches cold very easily and very restless to the infinity. Now the child is sleeping, but we have observed tremendous restlessness. So tremendous restlessness, tremendous desire, excessive desire for salt, and salt causes anemia. Salt causes anemia. So excessive desire for salt and great restlessness and desire for cold drinks, desire for fish, meat, egg, etc. We may think of phosphorus. Phosphorus has a great affinity over the blood. If you go through the Bogar synoptic key, there is a chapter at the very beginning. Bogar started his Mathematica at the region, titling the region, and the phosphorus acts over the blood. Phosphorus acts over the blood, and that's why it has caused hemorrhagic diathesis. Hemorrhagic. If you go through the Shankaran's Mathematica, just tonight, yesterday night, I have demonstrated about the Shankaran's book. He has written in the phosphorus produces jaundice, and it has wonderful action over the hemorrhage. So phosphorus is the choice of medicine. It covers the pathology, it covers the fears of action, it covers the other symptomatology of the patient, desire for cold drinks, restlessness to the infinity, tremendous desire for salt, and phosphorus also antidote salt. This anemia may develop due to excessive taking of salt. However, phosphorus is to be administered in 50 millisievert scale of potencies. I shall share you the result after 3 months, my friends. Anemia, এখন আমরা দেখে রাখলাম, তার আছে 9.8 গ্রাম পার্সেন্টেজ আমরা নোট রাখছি, পরের বার আমরা নোট দেখব, and I shall share this video in the next time. Please remember the number of this video. The child age about 2.5 years has been suffering from severe malabsorption anemia or idiopathic anemia. Let's see the result after administering phosphorus in 50 millisievert scale of potencies, my friend. Once daily model.